When the room suddenly starts spinning, understanding benign paroxysmal positional vertigo. Hello, my dear friends. This is Dr. Charles from PatientCareLinks, where we share practical health lessons drawn from real experiences that help you understand your body and protect your health. Have you ever rolled over in bed, looked up to reach for something, bent down to pick up an object, and suddenly felt as though the whole room was spinning? For a few seconds, it can be frightening. Some people think they are having a stroke. Others worry that their blood pressure has suddenly dropped. Some are afraid they have a brain tumor, but sometimes the problem is neither the brain nor the heart. Sometimes it begins deep inside the inner ear. Today, let us understand one of the most common causes of sudden spinning dizziness, benign paroxysmal positional vertigo, or BPPV. Many people with BPPV notice a very specific pattern. The dizziness happens when they change the position of the head, turning over in bed, looking up, or looking down. Getting out of bed. For a few seconds, the room seems to spin. Then it settles. They may feel slightly unsteady afterwards. Because the episodes are brief, many people ignore them. But as they become more frequent, even simple daily activities can become worrying. Inside each ear is a remarkable balance system. It constantly tells the brain how your head is moving. Tiny calcium crystals help this system work properly. Normally, these crystals stay in one place, but sometimes a few crystals become loose and move into one of the balance canals of the inner ear. When you change the position of your head, these loose crystals move where they should not. They send confusing signals to the brain. Your eyes say you are still. Your inner ear says you are moving. The brain becomes confused, and suddenly the room feels as though it is spinning. Although it feels dramatic, the spinning usually lasts less than a minute. From a doctor's perspective, BPPV is one of several possible causes of dizziness. The doctor will ask, when does the dizziness occur? How long does it last? Is there hearing loss? Is there weakness, numbness, or difficulty speaking? A simple examination, sometimes including the Dix-Hall-Pike test, can often help confirm the diagnosis. Treatment may involve special head movements, such as the airplane maneuver. Persistent dizziness, severe headache, weakness, double vision. Difficulty speaking, chest pain, or loss of consciousness requires urgent medical assessment. Now bring in the nursing perspective. Nurses help patients reduce the risk of falls while symptoms are being managed. They may advise patients to move slowly, avoid sudden head movements during an episode, use support if feeling unsteady, seek medical attention if symptoms change or become more severe. Safety is just as important as treatment. Now bring in the pharmacist perspective. Many people immediately ask for tablets to stop the dizziness. While medicines may be used for short-term relief, they don't fix the crystals. The most effective treatment is often the repositioning maneuver performed by a professional. Pharmacists help you use medicine safely and know when to see a doctor. Now bring in the physiotherapist perspective. Physiotherapists trained in vestibular rehabilitation can teach exercises and repositioning techniques that help restore normal balance. They also help patients regain confidence in movement and reduce the fear of triggering another episode. For many people, these treatments provide significant relief. Now step back and connect the full picture. Loose crystals move inside the inner ear. The balance system sends confusing messages. The brain receives mixed signals. The room appears to spin. Fear follows. But understanding what is happening often removes much of the anxiety. The spinning sensation is real. The cause is often treatable. BPV is common and treatable. If dizziness returns when you change head position, seek medical evaluation. Protect your balance. Seek professional care when symptoms persist. Because sometimes what feels like the world spinning is just your inner ear asking for help. Patient Care Links, empowering wellness, preventing illness.